Hi, I'm Dr. David Sarwark. I'm the Associate Dean for Research in the College of Public Health at Temple University. And it's a pleasure to have you join us today in our latest installment of research highlights within the college. I'm joined today by Dr. Beth Pfeiffer, Associate Professor in the Department of Rehabilitation Sciences, who's going to talk to us today about some of the recent research that she's doing in the area of young adults who are affected by autism. So Beth, do you want to tell us a little bit about some of the work that you've done previously around issues of individuals with autism and the struggles that they face with employment?
So we did some work on employment and what the barriers were and the environmental barriers were to being able to be successfully employed and maintain employment. And through our work with that, we've initiated developing an intervention that focuses on the person-environment fit, as well as developing measures to look at that fit. And along with that, through that process, we also realized that one of the biggest barriers to employment for this population is transportation. So that led us to a new initiative and agenda where we're starting to look at peer-mediated interventions for transitional age youth, young adults with ASD, with autism.
So when you talk about fit of employment, can you give us a more concrete example of the types of jobs that young adults with autism will often seek and the ones that end up being a good fit?
It's not always about the job. We're really looking at the environmental fit and the fit with the unique characteristics of the person, which can vary greatly among individuals with autism, as it's a spectrum disorder. So we look at what their unique characteristics are, and then we look at the environment and we see if that works. And that environment is pretty broad. So it could be, what are the social demands of the environment? It could be policy aspects of that employment and the people that are the employers. It could also be the sensory environment. So we look at that because there's, as part of the diagnosis, actually, individuals with autism frequently have a different way of processing sensory information in the environment. So we may look at that. We may look at the physical environment, which goes along with the sensory factors.
So what are some of the things in the environment that might overstimulate a young adult with autism?
So it depends on how they process information, but a number of individuals are more hypersensitive. So if there's competing background, let's say they're in an environment, we're working in an office environment where there's cubicles. There's a lot of noise in the background and a lot of competing noise. So that individual may have a hard time processing information. One individual in our study was somebody who worked at a phone center. So that environment is extremely noisy and overstimulating. They were very good at what they did, but they were frequently distracted and a hard time. So some of our recommendations were to modify that environment, and they were very successful with those simple modifications.
And then my understanding too is that with young adults with autism, while many people often think that individuals tend to be very quiet, very socially withdrawn, some of them actually do desire some level of social contact, but they may struggle to form their social relationships in the same way as somebody who's not affected by the disease, correct?
That's absolutely correct. In fact, we've done some past research where people reported exactly that. I desire these social relationships, I want them, but I just don't know how to make that happen or what to do. And so in that previous study that we did, people talked about how they actually learned some of their social interactions by watching what other people did, by watching TV. I mean, it's very unique, it's very interesting, and how some of the adults describe that process. So that is something that many people do desire.
But isn't that true for a lot of us, that we sometimes learn our social behaviors from what we see in the mass media or what we see in our peers and our friends as we're growing up?
Absolutely. I think the uniqueness with autism is that it is they often call it a pragmatic social disorder, so picking up some of those nonverbals, picking up some of those cues that typically would happen very naturally for us are very challenging for an individual with autism, and therefore they may not respond appropriately in that social situation. They may realize that people are treating them differently, but they're not sure why. So some of that awareness is not always there.
And so moving to the work you're going to start doing, how did those troubles with social cues, how do those affect the challenges that come with transportation to a job or going out socially with friends?
Well, I think it varied significantly. A lot of it was multiple environmental factors that were impacting the ability to use transportations, and sometimes just skill and knowledge and experience. So there was that social component of needing to interact with people to be able to figure out where you're supposed to go, how do you get there, what's a safe interaction, what's not a safe interaction on public transportation. How do you communicate with the driver? How do you figure out when you're going to stop at your next stop? So there's a lot of things that you navigate, and many of these things are people that just in general for the first time are learning to use public transportation, need to know how to navigate. But some of that social awareness is really important and critical when you're in a situation like taking public transportation, and so those are aspects that we really need to target. I think a unique aspect of some of the transportation work we're doing as well is that we're looking at peer-mediated transportation work, which is founded on the idea of the self-efficacy. If somebody sees that somebody who's similar to them can do this and they're successful, then they have the belief that they can do it too. So that's a pretty unique aspect of this transportation training that we're looking at.
So it sounds like you may use peers as a way to model those behaviors and help people navigate the challenges of public transportation for the first time to allow them to go and interact with employers, get on out socially, and do the things that they want to do.
Exactly.
Well, great. I want to thank you for joining me today. It's been great to hear a little bit about your work and look forward to hearing more about it in the future.
Thank you.